It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Okay, next guest is Dr. Otano Silva. We're going to talk about interventional orthopedics. What's that in a nutshell?
Interventional orthopedics is basically intervening with injections, biologics to promote healing and injury prevention.
Okay, Dr. Silva and Shannon O'Kelly on Como.
Dr. Silva, welcome to Health Talk. Hey, I'm glad you're here today. We're going to talk about interventional medicine. That's kind of your area of practice. But I always like to talk about your practice. Tell our listeners what you do, what the day in the life of Dr. Silva is.
Great. Thanks for having me. I'm really excited to tell you about this topic of interventional orthopedics and regenerative medicine, something I'm very passionate about, and I feel like people really need to know what's going on out there. I practice interventional orthopedics at the Interventional Orthopedics of Washington. This is a new specialty in the field of medicine where I inject orthobiologics into muscles, bones, tendons, ligaments, around nerves, into cartilage. All this done under precise image guidance in an attempt to regenerate your tissue so that you feel better and can do more things. This is similar to the field of interventional cardiology, which initially started as open surgical procedure and has now become so advanced that you can do CABG or valve replacements with a sophisticated needle.
Yeah, it's pretty amazing, the stuff going on in medicine today and the advances in technology. Tell us, how are you trained and what was your training? How did you get interested in this new area of medicine, interventional rejuvenation or regenerative medicine?
I did the traditional medical school and then residency. I did a year of surgery. And after my specialty in physical medicine and rehabilitation, I decided to get specialized by doing a one-year fellowship in interventional orthopedics. And that was a full-time practice of regenerative medicine, doing all injections from head to toe in an attempt to complement the body's own natural process of healing so that people can get better without utilizing the traditional model of high-dose cortisone injections, anti-inflammatory medications, or surgery, which all have their own complications and side effects.
So let's talk about a little physiology. Let's go back to that healing process. When we injure our bodies, there's a healing process that is initiated by your body. And that healing process sometimes takes time or sometimes needs a little oomph. And would you say, in kind of a nutshell here, interventional medicine, you're trying to help and promote that healing process and help your body get through that?
Exactly. So many times, people will sprain their ankle, for example.
Right.
And they'll take an anti-inflammatory medication, which calms down the inflammation. But that inflammation is actually the body's own attempt to heal itself. And if you complement that system, those ligaments will tighten and remain stable so that you have a better functioning ankle. But if you're either looking at doing a steroid injection or an anti-inflammatory medication, then that's going to stop the process of the body trying to heal itself.
Well, that's important. Let's talk about that a little bit. So I really want our listeners to understand kind of this sequence. So let's talk about that ligament. You sprain that ligament, you stretch that ligament in your ankle, your body recognizes that injured tissue and starts an inflammatory process. And essentially, at that process is calling out the body's kind of construction workers, the repair cells that come there.
Precisely.
But if you take anti-inflammatories or certain things, it kind of impedes or slows down that repair or those construction cells that are coming out to work on that injured ligament.
Correct. When you injure yourself, even though inflammation might be painful, it is how the body is signaling your own stem cells to get to work and repair it so that your ligament can remain tight and support the ankle when you're doing those activities like running and jumping. But if you stop that process, then suddenly the ligament won't fully heal, and you may end up with something that's called a loose joint or unstable joint that can then predispose you to worsening osteoarthritis down the road.
Right. You mentioned stem cells, and I think, again, it's important. Stem cells are... Describe stem cells for our listeners, because I'm sure our listeners have heard, genetic stem cells, your own stem cells. Maybe talk about stem cells.
Yeah, stem cells is a very hot topic right now, and consumers need to be educated so they can protect themselves from the fraud that's occurring out there.
More with Dr. Otano Silva talking about interventional orthopedics next on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Our conversation with Dr. Otano Silva continues right now on Como.
Dr. Silva, again, thank you for coming down. Thank you for sharing all your information regarding interventional medicine and rejuvenation processes. We were talking about stem cells, and I think you were mentioning the consumer has to be careful because it is a hot topic. We read it and see it in the media right now, stem cells. Kind of give us some guidelines on stem cells or some guidance.
Yes, there's 4 things I want consumers to be aware of, and I'll talk about them in bullet points and then expand into detail. First, you want to make sure you have a trained medical doctor who specializes solely in regenerative medicine. Then you want to make sure those stem cells come from your own body. Then you want to make sure that those stem cells are injected precisely under image guidance where they need to be, and that stem cell or PRP or whatever orthobiologic they may be using can be customized to your need.
And just real quick, so a stem cell, the word stem cell is basically this basic cell in your body that is all over your body. And when your body needs to repair a specific tissue, that stem cell then turns into that tissue, whether it's skin, cartilage, or whatever it needs to become.
That is one of the misconceptions that a lot of people don't quite understand. A stem cell is like a general contractor that organizes all of the other cells and releases a variety of cytokines and DNA and RNA to share with the other cells that are trying to repair this injured tissue. Sometimes the cell will become a cartilage cell or a bone cell or whatever it needs to be, but the major portion of its work is all in the organization and coordination of that injury and healing process.
That's interesting. So the stem cell, I like how you described that, a general contractor. So you talked about these stem cells. Maybe let's talk about some specific treatments that you provide at your center. I'm interested to see what you do and how you do it and what you treat. Can you give us some examples of some stuff you might see, some diagnoses?
Absolutely. So I treat everything head to toe: spine conditions, back pain, ACL tears, sports injuries, rotator cuff tears, and many times patients can avoid surgery and chronic habituation of pain medications or cortisone injections. I don't do most of those things. So it's a little different than your traditional care model. Traditionally, doctors will prescribe anti-inflammatory medications, give you a cortisone injection, both which have their own side effects and result in potentially increased risk of stroke, heart attack, kidney disease, GI ulcers, osteopenia, lowered immune system, raised blood pressure, and the list goes on. I focus 100% on regenerative medicine. And for example, something I treat commonly is a meniscus tear in the knee. The knee had a problem to begin with that resulted in the meniscus tear. By treating the meniscus tear, you're not actually addressing the underlying dysfunction that resulted in that tear. So when patients come see me, I spend a full hour evaluating them head to toe, undressing what I can see as the underlying cause of dysfunction. So I'll work on stabilizing the knee and treating the meniscus so that people feel better and prevent the other surgeries and medications that don't necessarily help them heal for the long run, so they can get back to doing what they love.
Well, talking about love, I can tell you love what you do. Dr. Silva, thank you so much for joining us on Health Talk. We'll definitely have to have you back. Thank you.
Thank you.
That has been Dr. Otano Silva, interventional orthopedic physician from Interventional Orthopedics of Washington and Bellevue. And you can get more information at their website, Orthopedic Physicians in Bellevue. We're going to come back with our final segment right after this timeout on Como.